Hello everyone and welcome to our second AHP support worker webinar. Today we have some fantastic AHP support workers. We have a podiatry technician, a physiotherapy support worker and a dietetic assistant. Thank you so much for giving up your time to listen to the fantastic stories from our AHP support workers. Enjoy. So what's coming up on today's webinar? We'll have an introduction to allied health professionals, also known as AHPs. We'll have an understanding of our allied health professional support worker roles. We'll hear from our AHP support workers and their journeys and stories of their careers. We'll have time for questions and then we'll end on a signposting for more information. At any point through the webinar, you can use the chat function to ask any questions and we'll get back to you as soon as we can. Enjoy. There are 16 different professions that sit under the allied health professional umbrella. We're also known as AHPs. AHPs are trained specialists that work in multiple areas across health and social care. You'll find us in hospitals, in community settings, in schools, even in prisons. AHPs are pretty much everywhere. Part of the AHP workforce includes our students, our apprenticeships, and our support workers, as well as our registered professionals. The AHP support workforce is vital to our workforce and to the work we do to give the best care we can to our patients and the people we serve. Allied health professional support workers usually work alongside our registered allied health professionals and assist in delivering care and treatment. There's a range of different job titles and duties depending on the team that they are part of. They often work directly with patients, families, and carers. What we see in our support workers is very caring, good communication, great teamwork. These are some of the skills and qualities that we see within our allied health professional support workforce. There are different levels or bandings for support worker roles, and experience can lead to advancing in those roles and the different areas within our AHP support workers. Here are some typical education and training requirements for our AHP support workers within our region. The band will often reflect the level of responsibility that individual will take within that role. But now you're going to hear from our AHP support workers themselves and understand more about what their role involves and hear their fantastic stories and their amazing contribution they make every day. Please welcome our AHP support workers.
Hello everyone, my name's Claire and I'm a podiatry technician for South Tees Community Podiatry. Next slide please. So in podiatry we work with a lot of different people such as the podiatrists themselves, other podiatry support staff like technicians, nurses and healthcare assistants, physios, occupational therapists, orthotists, GPs, other community health teams and patients and carers. As podiatry technicians, we work together to deliver effective patient care, and our teamwork ensures accurate assessment, efficient procedures and improved outcomes for patients with foot and lower limb issues. Next slide please. Where do we work? We work all over. So not only do we work in the community, we work in hospitals, private clinics, community health centres, care homes, residential facilities. We do home visits to go out to the patients, rehab centres for patients who are recovering from surgery, and we also work in the podiatry lab. And that's what I do in my job. That's what I really focus on. We work in diverse settings, both in clinics and out in the community, to ensure everybody has access to good quality foot care. Next slide, please. The prospects for progression in podiatry, there's lots of ways that you can go. You can progress to be a podiatrist with further education. You can go into a specialist role such as diabetic foot care or wound management. You could go on to be a senior, taking on that little bit more responsibility, managing the operation. You could go into training and education, so you could go into teaching, mentoring staff, and there's other healthcare pathways such as going into orthotics. We have really strong opportunities to grow here in podiatry and across the wider healthcare sector. Next slide, please. So podiatrist day is busy, but it's all hands-on, combining clinical work, patient support and technical tasks. So you would be looking at things like setting up clinics, so setting up a treatment room, ensuring the equipment is clean and ready to use, assisting during procedures such as nail surgery, wound care or routine foot treatments. You can do clinical recordings, so updating the patient's notes while the podiatrist is doing the treatments. And like I said before, the podiatry lab, so you would be in there repairing, modifying or making orthotics. Next slide, please. The other activities that we do is patient education, so making sure that you're giving your patients correct information on what foot care, some foot care advice, footwear choices and aftercare instructions for things like nail surgery and wound care. Stock equipment and management, so making sure that everything's stocked up ready for the podiatrist to use and making sure that all hygiene standards are met. And the most important one is teamwork and communication, working closely with the podiatrist, other healthcare professionals and the patients to deliver coordinated care. Each day is so different, balancing patient interaction, technical skills and teamwork to help people stay mobile and pain-free. Next slide, please. Next slide, please. Oh, thank you. So what I love most about my role is making a difference, helping patients stay mobile, comfortable and confident in the daily lives. It gives me and everybody here in podiatry real satisfaction. We know we're making a difference. Hands-on work. I do enjoy the practical side of the job, assisting in treatments and crafting and adjusting insoles in the lab. And teamwork, working closely with podiatrists and other healthcare professionals, creating a supportive, collaborative environment for everyone. Next slide, please. Another important one is patient interacting, so building the trust with the patients, because here in podiatry we do see patients on recalls, so we see them every 6-8 weeks, so it's nice to build up that little bit of trust with them. No 2 days are the same here in podiatry, so one day I could be in clinic, one day I could be in the lab, the next day I could be in the community. And continuous learning, there's always something new to learn. Every day is a school day here in podiatry. So being a podiatry technician allows me to combine care, creativity and teamwork while making a real difference in people's lives. Next slide, please. I thought I would put in a little bit of personal reflection about my role and how it makes me feel. So working as a podiatry technician, it's gave me a deep appreciation for the impact and quality foot care that can have in someone's life. I've learned that small improvements in mobility can make a huge difference in a patient's confidence, independence and well-being. The role has taught me the importance of patience, empathy and teamwork. I have developed strong communication skills, gained valuable hands-on experience from assisting in treatment to crafting and modifying insoles in the lab. Next slide, please. What I value most is being part of a profession that helps people every day. Seeing patients leave more comfortable and confident reminds me why I chose this career. It's rewarding, meaningful and constantly evolving. One of the things I love most is working with a great team. Collaborating with dedicated podiatrists and colleagues makes every day enjoyable, supporting and full of learning opportunities. And I've popped in a little video, I don't know if you can press play on that, just so that you can see me working in the lab, what I love doing the most. and thank you.
Thanks, Claire. Now we're going to move on to Liz Walton and Sheila McKenna. We've got Sheila on the call who will be around later on for any questions. They're both physiotherapy support workers in a children's physical disability team at Sunderland and South Tyneside. So we're going to move on to the next slide and it should start automatically.
So can you tell me to start your name and the team that you work for?
My name's Sheila.
And my name's Liz.
And we work in children's physio for South Tyneside and Sunderland NHS Trust.
So can you tell me a little bit about your job, the type of people that you work with?
Yeah.
So we work from 0 to 19 service. We work in community and we also work in special schools. We have 2 special schools we go into with totally different patients. Sheila goes into one, I go into the other.
So the school that I go in is for mostly cerebral palsy children who are non-verbal and who are not mobile. So they are in a special seating, or they may have a special standing frame to get them up and to keep their organs, because we need to be standing up to keep everything working. And they are profound learning disability, where Liz is a little bit different.
Yeah, so our children in our school, we follow the curriculum, so the children we see are mostly cerebral palsy, spina bifida, and they don't have a learning difficulty. So at the end of when they're 15, 16, they do their GCSEs. So we're both totally different from the people out, the children that we see.
And what's the kind of goals of what you're doing with them?
It's to basically maintain what they've got. They've got a disability and we don't want them to get any worse. So the physio would assess them and we carry out the programme, which could be on a trampoline, which is really good fun. And even though our children in this school are non-verbal, they do enjoy the trampoline. You can see them smiling, expressing, and we do a lot of singing, and it's a very happy place to be. So we can see them in the classroom as well, where other children are, and other teachers and assistants, so they know how to do the programme as well. And the school also do have a warm swimming pool for the children to go into. I don't personally go in, but Liz has been in before in the school that you work in, haven't you?
Our school has a pool, so a Monday morning typically is going in the pool, taking the children in, and this is a nice relaxing environment for the children. Relaxes their muscles, they can do more exercises in the pool because of the buoyancy of the water, and they really enjoy it. Lots of fun and games, ball throwing, basketball, things like that. They have a great time.
That sounds brilliant. Is that a typical day, or do you have other things that you have to do as well?
So with working in the community, we see children in the hospital and their families. So part of my job is to go in with the physio. The physio would assess the child, and then I would carry out a home programme exercise for them to do at home. But I also do fun stuff as well. We're doing obstacle courses for the areas that they may be struggling. So they might have a core weakness, the tummy, or they might have balance issues, or a learning disability, or they may struggle walking. So I do obstacle courses to get them. We've got like trampoline, we've got beam work, we've got ball work, floor work, and make it fun, because we don't want the child to get disheartened, so we try and make it a fun session. Liz is slightly different.
Yeah, so I do what's called an orthotic clinic. Orthotic is to do with the their limbs and how we can help them. Children with cerebral palsy often need a splint to keep their legs stable, help them walk and things like that. So once a week we go into schools, special schools on the morning, afternoon we have a clinic in the hospital. So we're seeing community patients. It's providing insoles for children with flat feet. And we do a carbon fibre insole, which is solid, and that's for tiptoe walkers. We do get a lot of tiptoe walkers. We also supply hand splints for trouble with their fingers and movement. Most of the things that we supply are for arms and legs. Any trouble, that's what we do.
So
We do have a wheelchair clinic as well. Liz is mostly involved in that, where the children will come in and will review their wheelchairs, because I would say in the special schools 90% of the children have a wheelchair.
So there's lots of variety there that you do in your day. Can you tell us what's the best part of your job?
Oh, working with the children.
Yeah, working with the children,
Yeah.
making a difference.
Yeah.
You're seeing these children, a lot of them we're going to see from them being born to them being 18, so we get to know the families really well, we get to know their brothers, their sisters, their life, and it's really nice seeing them grow up and going on to do different things. The school I work in, with them doing the curriculum, we've had them like go on to be teachers and things, which is really nice to see.
Yeah, it is good. And sometimes our grandparents come in as well. If parents are, at work and they know your name, they'll phone up. And sometimes they do have other problems, and we'll always say we're at the end of a phone, and we do have parents ringing up and they're not quite sure what to do. So they may ask for Liz or myself just to reassure them or to help them, and we go on and maybe contact other professionals.
Signpost them in the right
yeah,
direction.
Yeah. And also we do a little bit of Makaton in our school as well, the special school I'm in. So I know very basic stuff.
What's Makaton?
Makaton is like a for children who do not speak. It's like a sign language, which again is for people who can't speak.
And it's very basic.
It is very
Sheila?
basic that we do, but in the school what I really love is to do a Christmas Makaton, they do Halloween, Easter, and they have signs throughout the school. So it's a very easy thing to pick up, and the kids absolutely love it because it's a way of communicating with them. Yeah.
One last question. If anyone was thinking about being a physiotherapy support worker in a children's setting, have you got any advice for them or any top tips?
Yeah, you've just got to go with it, and you've got to be. I've been in this
Child
job 26 years, and I love it. Every day is a school day. There's always something new. There's different children coming in the service, and it's a happy environment, and it's a great team to work with as well. And the children are the most important thing.
And we've just got to be children at heart and
get
play,
down on the floor
and play with them.
Yeah.
Act silly, that's what children love.
That sounds amazing. Thank you for your time,
Thank
Sheila and
you.
Liz.
Hi. So this afternoon I've got a child who is a 3-year-old and she has CP. It affects all her limbs, especially her lower limbs. She's quite good with her upper limbs, so we're going to do a little bit of both. I'm going to start off. She can roll, so we've actually advanced from rolling, and she can go on her back, she can go on her tummy. So I'm trying to challenge her. This little girl has EFOs, which are splints to help her stand. She does have a walker, but it's not here, so I can't show you the walker. So I'm just going to do a little bit of floor mat exercises to give you an idea what I do. So we'll have this one, and it's for sit to stand. So usually she would be sitting there in front of me, And this is to work on her quads. Also a little bit of core as well. She's very low toned. So I would get her sitting there with her splints on and her footwear. She cannot do it barefoot because of the shape of her feet. So I'd encourage her to come up into standing and then come back down. It's very difficult to get a 3-year-old to do that, so sometimes I'll bring out some beanie animals to encourage play, and I may ask for the help of parents to engage in this activity. So I may ask Mum, who she usually comes with, to stand here with 2 little animals, and I'll give the child 2 little animals to come up and give high five, and I'll facilitate a little bit around the hips. So getting that to come up into standing and a little bit high five and come back down again. This is something we're working on, and she's doing quite well, but sometimes she just doesn't want to do this, so I have to leave that alone, go to something else, and I may return in the same session or in a different session. So that's sit to stand for our core and a little bit for our quads. This one is encouraging her to sit astride, so she's only little, so it's getting her to sit and her feet are in a good position, and what I want her to do is to come up into standing, which she can do, but sometimes she needs a little bit of facilitation around the hips because she isn't very strong.
This slide here, this just shows some of the activities that they do in the session. So there's some pictures from the gym, and then there's some examples of the sprints that they use, and a little picture at the bottom on the right showing how they get the right foot measurements. So I think that's children's physiotherapy support workers covered for now. Next slide.
We now have Ebony, who's going to talk to us about being a dietetic assistant at South Tees.
Well, hi there, my name's Ebony. I am a dietetic assistant at South Tees. I've been working for the Trust for about 2 years now as a dietetic assistant. I've just put some pictures up there of us all just to put a name to the faces and kind of how our roles all differ kind of slightly. So there's myself who's a dietetic assistant. We've got a dietetic assistant practitioner. We've also got 2 nutrition coordinators as well, which are all slightly different. Dan and Naz, they cover some of the same aspects that we do, but they ensure that nutritional care pathways and processes are in place for inpatient areas, just to benefit timely and effective patient care. So some of the jobs that they do is education of training of staff and students and volunteers. So they'll go up to the ward and do a bit of nutrition training with them. They'll do audits and clinical assurance checks to ensure the wards are compliant with key standards of nutritional care. So they work really closely with the catering team as well and develop menus and help develop the menus. Dietetic assistants are similar to this, but they aren't as involved with the catering side of things. They're more patient focused as well. Next slide, please. So who do DAs work with? So we work with adults and children and young people with a variety of different nutritional needs. So this is things like nutrition support, so people underweight or suffering from malnutrition, gastro, IBS, IBD, palliative care, oncology, diabetes and renal. So dietetic assistants can work alongside the dietitians in those specific areas. Where they work, so they can work in acute and community settings, and they do also education of other health professionals. So they can travel to nursing homes or schools and do a little bit of education on nutrition. What setting do I work in? So I do a bit of a mixture. I do 3 days of community work, and then I do 1 day of acute. So my 3 days, they kind of consist of nursing home reviews, home visits, weight checks. I mainly work with adults. So what are the prospects of progression as a DA? So there is now a dietetic apprenticeship with Teesside University. This is their 3rd year running it. Myself is on the 3rd year, so currently started this year. And Dan and Naz are both in their first and sorry, I'm in my 1st year. Dan is in his 3rd year, and Naz is in their 2nd year. So we're all 3 of us are on the course at the moment. What type of activities make up a typical day? So telephone review clinics, so normally done from the office. I do nursing home visits. We've got quite a big patch of nursing homes that we all attend and review patients there. Home weight checks, so normally myself will go and visit the patient in their home, weigh them, see how they're doing, see how their intake is at the moment. I'll also do what we call supplement trial reviews. So this is where we order supplement drinks to the patient's home. And what we'll do is we'll ring them up and see how they were getting on with them. If they liked them, if they didn't, then we would probably do a letter to the GP to prescribe them. What do you love most about your role? I personally love working in the community. I love seeing patients face to face, having that kind of rapport connection with them. Yeah, and I feel like once you see them kind of reach their goals and help them get to where they want to be, it's quite satisfying, and I do enjoy that side of it. Next slide, please. I've just put a little bit of an example on there of someone that we would normally see in the community. So this lady is living in a care home at the moment. We have screened her for malnutrition, and she's come up as a high risk of malnutrition. So we got a little bit of weight history there. We can see that her weight is quite low, and her BMI score is under what we would class as low weight. So the dietitian would then go in and do their energy requirements, so find out how many calories that this lady needs, and from there looking at how much this lady is eating. So as you can see from there, she's only eating really a quarter of her meals. So that means, she's not doing too great with her intake. So therefore, we can establish that she might need some supplements to be able to help her meet her requirements. So that's kind of just a broad example of someone we would see. Next slide, please. I've popped on there as well a little timeline of my career and how I got into this role. So I started university in 2018 at Teesside. I did food and nutrition science to start with. You don't need a degree to do this role, but that was something that I was interested in, so it was a good step to get into the role. Graduated in 2022, and then I started with South Tees in 2023, part-time at the start, and then moved into full-time after about 6 months. And then now skipping to 2025, where I got onto the Teesside University apprenticeship this year. Just wanted to speak a little bit about the apprenticeship as well, how, starting full-time job and then going back to uni, it hasn't been easy, but I definitely feel like I've got back into the groove of it now, and it has become easier trying to balance uni and work at the same time. And South Tees have been really, really good with accommodating that as well. So it's something I would definitely recommend. Yep, next slide. So I just wanted to put on there as well a little bit of how our impact has changed things for the better. So one of the things that I was involved with was doing some care home training and some malnutrition training for their staff. So we would travel from different nursing homes throughout Hambleton and Richmond, and we would do this session to try and help promote that first line food first care in nursing and care homes. So the things that we covered was things like how to screen for malnutrition, so educating the staff that how to implement what we call the must-one pathway. So high calorie food fortification, things that they could do to try and prevent that malnutrition early on. And also how to prioritize food and fluids in care homes as well. The results of that have been really great. So I've popped on some pictures of what's come of that. So they've done things like charity cook-off in the homes. So they've done like a little bake sale, and all the profit goes to charity. They've been doing make your own pizza nights. So the residents have been having to decorate their own little pizzas. There's also a few pictures that I wasn't able to get hold of, but they did create your own snack board. So they did high calories ingredients on their little snack board and tried to make it into like a colourful picture, which was really lovely. They've also done a design your own water bottle. So they got them to design their own water bottle just to try and highlight the importance of fluids as well. The outcome of that we've seen is that the referrals from, you know, not only this nursing home, but a few nursing homes has come down. You know, they've been able to implement that food first approach before the referrals even got to us, which has been really successful. It's obviously an early intervention to prevent malnutrition in care homes, which has been great. Yeah, next slide. I've just done a little video of a day in the life of a dietetic assistant in the community. Yeah, you can press play. This is me arriving at work at 8:15 and getting into our building. This is me getting settled at my desk with a nice cup of coffee to start the morning. First job is to go through my emails and start a to-do list for the day. First on my to-do list this morning is organising and ordering all the diabetes resources for our patient group education sessions. These ones are all from Diabetes UK. After I've done that, it's time to start calling patients for their reviews. This morning I had 4 people to call and to type up all of their consultation. Right after lunch, I'm off to the nursing home, but first I'm giving a quick wave to all the dietitians all hard at work. I'm on my way to one of our nursing homes. I'm going to review 4 patients, and all with nutrition support needs. Once that's done, I'll make my way back to the office, which is only a couple of minutes away, to finish typing up and to liaise with the dietitians on the plans of the patients. Final thing for the day, I'm going to pick up a few tasks from our system to order some supplements for our patients. This is through the Nutrition website or Nueltra website, and then I'll book them back into my rota to call to see how they got on with them and if they tolerated them. Now the day's done and it's time to lock up and go home.
They were absolutely fantastic presentations. I thoroughly enjoyed that. I love hearing all your stories, and I love seeing some of the videos as well. Just because it gives a really good idea into what the day-to-day life is. So it's really good to see those glimpses of what everyone's doing, and the roles are so diverse. I think that's what we want to try to really get across today, that there's so many different roles with the allied health support workers, and I hope that came across. It definitely came across to me with the presentations. I'm just going to check, has anyone on the call got a question that they want to either raise their hand or speak up or even put in the chat box to any of our presenters? If you want to put them on the spot and ask them a question, by all means, they're ready for it. Very quiet on these webinars. We do notice this, don't we? Sometimes get some questions after, and sometimes it gets them in the chat box. For the people who did the presentations, did you know about the other roles? No. So like even within our own workforce, we don't always know, do we? So it's really good to get those glimpses and just see how how we work. And we do have a hand up there. Do you want to come in? I can't see the name on it. I can just see the little round circle. But do you want to just come in and ask your question?
Hi, yeah, it's XP Gateshead. We've got a question from Olivia, which is kind of connected to that about before getting into these careers. So, Olivia, do you just want to speak up, darling?
Did you always know that the jobs were available for you to do? And also, I have another one. What made you want to do them?
Shall we take turns?
That's everyone.
That's to everyone. Claire, do you want to go first and answer?
Yeah, so I studied sports science, so sports was my background, and I enjoyed the biomechanics side of the sports science. Did I link sports science and podiatry together? No, I didn't. However, the job came up, and actually I enjoyed the biomechanics side of the sports science. Wasn't just based on feet or lower limbs, but I thought it's kind of what I want to do, and I am so glad that I took the job here. I feel like I've fitted in really well, and having that little bit of knowledge with the biomechanics and the sporty side of it has really helped me in my role.
Thank you, Claire. Sheila, do you want to share your information?
Yeah, I mean, I love working with children. It's not something I wanted to do. In fact, I had a lot of other jobs that I wasn't there for very long. I've been in this role for 26 years. And I came in with didn't really know a lot about children's pediatrics physio. And I thought, you know what, I need a new challenge in my life, so I'm going to go for it. And I've never turned back. I absolutely love it. I love working with kids. It's very rewarding. And it's completely different to anything I've done before. Before this, I was in retail. So I'm really pleased that I got the opportunity and the chance to work, especially in the NHS and with children with learning disabilities. So rewarding. And I'm still here, and I'm here for a little bit longer. So it's the best thing I've ever done.
Thank you, Sheila. Over to Ebony. Can you remember the question, Ebony? It's in the chat.
Yeah, so from me, I think I was always interested in food. Always loved cooking, loved fueling myself. I was really interested in that. So when I went and did my undergrad in food and nutrition science, I thought that was the role that I wanted to be in. I wanted to be more manufactural, going into jobs like My Protein or things like that. But then when I realized I did kind of a module on more clinical stuff, and I really wanted to be in a people-facing role. I wanted to speak to people. I wanted to help people. So I didn't really know that dietetic assistants existed. But when I kind of looked out for that within when I was finishing uni, yeah, that was something that I wanted to try, definitely. So that was kind of what sparked that for me.
Thank you. And I think Ebony and Sheila and Claire, that they've all said something similar, that they didn't really know about the roles, and the roles came up and kind of fitted them. And I think that's what does happen, that a lot of people don't know about these roles in the NHS or, in other organisations. So what we're trying to do today is share some information so that, when you're making your career choices, that the variety out there, because something like this, it might just spark your interest. And Ebony said she always had an interest in food, and now she's working in dietetics, so it's very related to her interest. And I think that's what you want from your career, something that you enjoy. Anyway, that's enough of my waffle. But yeah, a lot of people don't know about these roles, so we're trying to spread the message. So I think there's another question, and is it Georgia next with the question?
What qualifications did you need for the physiotherapist, or did you need any?
I think, Georgia, it's a basic, good English, good maths. I went to sixth form, didn't go to university. So I think working with children, I had children of my own as well. So when I did originally come for the interview, it was very much about a caring and being a mom, but not everyone has to be a mom to do that. I think it's just being a very caring person, but I didn't have, I just had the normal qualifications, so I'm very lucky. And you can do these types of jobs. You don't have to go to university to do support worker. So yeah, that's my qualifications. And since I've been in the trust, I have done a lot of I've improved by doing MVQs ×3, and also doing Makaton, which I'm really interested in with the kids. But just a basic good education. Yeah.
Yeah, and I'll just follow up on that. So I think at the start of the presentation, we showed you the different bandings for support workers. It'll be on the slides when we share it, but the entry level is band 2. And for band 2, we do just look for functional skills in maths and English. But then as you go through the bandings, you do tend to have to have either more qualifications or more experience. So within the roles, what we're looking to do now is we're looking to support people in their support worker roles and offer training, and we've got different awards that people can go on. Sheila mentioned NVQ. That'll be something that for the kind of younger people now you won't do, because we've changed qualifications and
I've shown the
there's
age there, Joanne.
you are, but never mind. That's fine. But there's higher development awards that that people do now. So yeah, so we do try and support our support workers with training and progression opportunities. And for some of we do have some support workers that are really qualified and they've come with degrees, just they haven't found a job that kind of they've been able to use their degree in. I hate to say, but they want to work in the area that they go into, and it's kind of helped them, but then they can go on and do training if their trust allows them to, like Ebony, who's doing our apprenticeship. So that's really good to hear that there's opportunities for support workers. So I've just seen another question in the chat, and this is from Amanda, and she's saying, what is your least favourite part of your jobs? I can hazard a guess at what most people are going to say, but I'll go over to them and let's hear from them.
I don't really have a least favourite part. Probably that I'm too busy and I don't have enough time for a cup of tea, but that's probably about it. I enjoy every part of my job.
They're very busy roles.
Yeah, really busy roles. I love my job. I've got no least favourite part at all. So that's the answer to my question. More tea is needed.
Thank you, Claire. Sheila, least favourite part of your role?
Wait, I turn. I'm a bit like, when you haven't really got anything apart from being busy, and what I've done is I've reduced my hours, so I find my days are very busy, but I've got loads of support of the rest of the team. I haven't got I can't think of anything that I dislike about my job.
That's brilliant, thank you. Ebony, are you going to be the same, or?
I feel like I am, yeah. I feel like it's really difficult to pick out. I think I would probably just say is just being so busy, but it ebbs and flows. I think, you have some days that are, oh my gosh, what am I doing this for? And then you have other days where you think, oh, do you know what? I really love my job. So, it's very difficult to pinpoint something that I don't like about it, because I do really enjoy it. So.
Well, that's wonderful to hear. I actually thought you were all going to say paperwork, because working in the NHS, we do have a lot of paperwork, but they've surprised me all by saying that they didn't even mention it. So it's obviously just me that doesn't like the paperwork. Okay, is there another question? Is the one from Rebecca? Can I just have a look at that? For anyone aspiring to work in your role, what would you say are the key skills or experience that would really help someone applying who may not have previous experience? So Rebecca's asking about skills the key skills for people that don't have previous experience in the role, what would you say? Claire, can I come to you first?
Yeah, that's fine. So I had absolutely no experience in podiatry at all. I didn't even know what podiatry was. And the thing that popped out to me the most when I applied for the role is, you need to be able to work in a team. Like, that's so important. That's how we provide care to the patients. Being able to work in a team is definitely up there. You have to obviously want to help people as well. You have to have empathy and compassion, and I think, like, as an experience for the job, a little experience is great, but I think it's you as a person, and if you've got the empathy, the compassion, you want to help people, then that's, for me, that's definitely up there when you're applying for a job in healthcare, for sure.
Thank you, Claire. Sheila, have you got anything that you want to add about key skills for working in children's physio?
Just a little bit what Claire said, it's just a bit about like, I didn't know anything about physio, children's physio. I didn't really know a lot about the NHS, but it was something I was always interested in and very proud. I think we've got a brilliant NHS. But being passionate and being a caring person, and empathy is a huge thing. So, and people who come into these roles are usually very passionate and very caring people. So that's probably about it, Joanne.
Thanks, Sheila. Ebony, sorry you're last again. Just if there's anything you've got to add.
Yeah, I think very similar to what the others said as well, but I would definitely say communication skills, speaking with patients, kind of links with the empathy and compassion to be able to communicate effectively with them. But it's being able to, sometimes we've had students come in who have all the knowledge, but really struggle to speak with the patient and be on their level, sort of, like to be able to communicate and speak with them. So I think that would be definitely a key skill, I think, to gain confidence in, is speaking, definitely.
Yeah, I would just add, and if I don't know if Alison or Emily want to come in and add anything, but when I do support worker interviews, what we're actually looking for is someone who can show that they're caring, that they can work as part of a team, and that they can follow instructions, because a lot of what support workers do is kind of following the advice from the clinician. They might have, they might be able to make their own decisions in the day, but it's still about being able to follow instructions. And the communication, as Ebony said, you've got to be able to be a good communicator and kind of relate to people at different levels, because when people come into our services, they come in with a variety of different needs and backgrounds, and it's just about being able to relate to them. I don't know if anyone else, Emily or Alison, if you want to add anything to that can.
I would just echo what you've said about the communication and the fact that, speaking to multiple levels. So you'll speak to the patients, their families, their carers, but then quite senior professionals as well. So that our support workforce are often very adaptable and can communicate at different levels. And really those skills, I would say, for that go across the allied health professional support workers.
I think that's the end of the questions. If there's not any others, we'll move on to this slide. So this is about virtual work experience. So this might help you, Rebecca, when you're thinking about skills and experience. So this is something that's been set up by SpringPod that all schools and colleges, well, anyone can access. And it gives an overview of the allied health professionals, the different professions, and there's lots of different activities in there, but it's classed as a virtual work experience. So that might be something that you might find helpful, and it'll be shared in the slides, so you could take a look at that. And then the last slide, I don't know if I'm meant to be doing this or if it's Alison, but I'll just roll with it because I've unmuted my microphone. The last slide is a QR code, and this takes you to a website called Aspiring Allies. And this is a really good website about all of the different allied health professions. So at the start, we mentioned the 16. We've only focused on 3 in this session today because it would be too much to go through all of them in one go. But this site will take you through them all. It's got a quiz so you can find out, you know, what best suits you, which profession matches your interests. But yeah, have a look at Aspiring Allies if you want to find out any more information, and it'll also signpost you to even more resources. But and anything else, any other questions, you can pop them in the chat. But I think that's us.